Good day, my dear students. Welcome to R.A.T.S for Postgraduates. The topic that you people see on the screen is from Recent Advances 24. There are certain subtleties in this presentation, which I would like you people to kindly register in your minds. These are all routines, that it is a university question for MD, so on and so forth. The topic as such is postmortem computed tomography and its applications by Guy and R.A.T.S and Bruno Morgan. As I always say, the recent advances will be a study and a presentation by experts in that field. So it will not be easy for us to compete with them and register what they are trying to deliver. And in this context, how do you make most of this class? I would request you people to kindly go to virtual autopsy in R.A.T.S. This is one of the first classes with regarding to technicals in autopsy. Secondly, listen. Watch the pictures. Write down the notes. Listen again. I would like you people to kindly follow this sequence deliberately and slowly. Because reading directly from recent advances will be difficult, it will consume time, and it might not be possible to deliver the goods with it. Again, if you are not listening, you are not learning. Do not fast forward, but be deliberate with each and every slide because it is worth its weight in gold. Coming to the introduction. Invasive autopsy has been the gold standard for thousands of years. Whereas the present trend is to minimize the usage of the conventional autopsy. There have been several alternatives to this, such as CT, MRI, a combination of CT and MRI, and minimal invasive techniques such as angiography. The difficulty is these are not accepted as equal to the conventional autopsy in the court of law or even otherwise. There are a few concerns which are working with it. And I would like you people to be familiar with these terminologies. Adult postmortem cross-section imaging and postmortem computed tomography. This is what we are going to use in today's class. Why? To improve the speed and the quality, we need this technique. And there is also a dislike for autopsies amongst the public and the religions. And in order to circumvent this, this might be required. So kindly do follow, and if you go to my original class on virtual autopsy, there will be many an overlap between these two. The terminologies. The problem again here is consistent terminology is needed. If you take any subject in medicine, over the years, there has been a terminology that has evolved, it has been studied, and it has stood the test of time. Whereas with new terminologies, it can be misleading or sometimes misguiding. And Hence, international experts have proposed a standard nomenclature which is in evolution. This is what we are doing in this study. Another one will be postmortem magnetic resonance imaging. And as I had mentioned, minimally invasive techniques. So these people should be familiar and rehearse it repeatedly because these will fetch you the marks. And the related terms are digital autopsy, virtual autopsy, vertopsy. These all have got somewhat the same meaning, and when a question is asked in one terminology, we would not be baffled by it. Doing more things faster is no substitute for doing the right things. And here there is a beautiful painting of a conventional autopsy that is going on. And there is also a visitor who is watching it. Fine. I used to use this quote in a different context. Today, we are all plagued with the term turnaround time. Without knowing the meaning or the implications, I used to generally counter. Do you want the correct diagnosis or do you want a rapid diagnosis? The historical overview runs like this. Radiology is one subject that is closely related to the imaging autopsies. And it has been used in homicide in England 1896. And computer tomography has become a routine in clinical forensic practice. Here, there is a lot of controversy whether it can be a replacement, but at least it is a supplement. Ballistic skull injury, a case of this was studied by this means in 1977. Computer tomography came into force in 1983. And these being used as adjunct and alternatives came from 94 onwards. Perinatal autopsies have been visualized by this method from this year. And there is an International Society for Forensic Radiology and Imaging in 2012. So this will be the sequence. Probably if you people go to the net or in the next couple of years, there might be more references and historical background to be quoted. The advantages of it, as I had mentioned, it is faster. And nowadays, we have got powerful CT scanners. Whatever is being used in clinical practice can be applicable in forensic or pathological diagnosis. Secondly, you find that the software also, all of us know the great advance in leaps and bounds in the software section. So definitely with these contributing, I have my own doubts whether the conventional methods alone will be able to compete with them. Chronological age. For example, this is a picture of a skull that has been exhumed, and then there is a dentition and so on. In forensic medicine, as well as in anatomy, they used to say the dentition, and you can tell the age of the patient and so on. So, for defining the dental age and for chronological age determination, this has been a study and it is from this. Also, for post-mortem examination, this is the reference. So I given you a couple of references. If you people want, you can go back to it. But for the time being, please do remember, it is for the determination of the chronological age of the victim or the patient. Computer tomography. Who, where, when, how. My professor of surgery used to say, always ask yourself the questions: what, when, why, where, how, and who. Because if you can answer these questions, obviously you will be able to answer most of the questions in your examination. These are the core questions for medico-legal autopsies. And sometimes it can be circumstantial also. How can you say such a thing? And there is a difference between a death at home and a death in the field. A death at home, we can be asking, how did it happen? And so on, so forth. Whereas a death in a field, when you are reporting, the questions will run like this: where did it happen? And at what time did it happen? So on. When was the person missing? So these are two different areas where the questions would be differing. These are not my words, these are the words of the authors. And post-mortem computer tomography can be supplementary. It can rarely become a replacement, and it can be used for invasive techniques such as a contrast angiogram, etc. Also, please do remember that when we are weak on the legal front, these can be produced in the court of law as important evidences and as turning points. But always I used to say that there is an element of manipulation that is probable. There can be an element of cooking up. So there can be a bit of misleading by a clever lawyer rather than leading by a genuine lawyer. So this is another terminology and it has been presented this, and this is the reference. The purpose of my presenting this is totally different. Now, this is almost being treated as a human being, and it is subjected to either computer tomography or magnetic resonance. Also, you find that there can be a robotic surgery or something that could be done. There can be an exhumation or extraction of a particular specimen. And whatever you people do, you find that it is being recorded. There are different types of this. I had mentioned in my previous class. You can have serial coronal sections. You can have serial sagittal sections. And you can reconstruct the entire ductal system or the blood vessels of a particular region also. And this can be used for criminology, histology, toxicology, etc. Coming back to the questions: who, where, when, and how. You find that the CT can be used for the identification of the cadaver. It can be used for the identification of the disfigured bodies. There can be a probable reconstruction, and we can go back to the original photograph of the person. You can produce a temporary mortuary at a center of mass fatality. So in a center of mass fatality, such as an earthquake or a war, etc., it is not possible. But then what you people do is take a sequence of pictures as such, file them, and later on you people analyze them leisurely. You compile them according to the sex, according to the age, according to the region, and according to the nation. Identification of the disaster victim. This is extremely important, particularly in insurance or in war. Teleradiology is another element that has come up, just like telepathology. So in this, the images are being taken, and if I do not understand much of it, I can always send it to my counterpart elsewhere, re-obtain the message or the opinion, and try to apply it in the circumstance. As I mentioned earlier, areas of military conflict. You know what is going on in Ukraine. I do not know how many of the bodies could be identified. And there is not only a loss of life and material, but also a lot of insurance and other things are included in it. Air crash. another example. And these are some of the centers. ISFR, International Society for Forensic Radiological Imaging. So this is extremely important. It has come up in countries like the UK and Australia. Odontogenic imaging I had mentioned. Fine fractures can be made out. I'll be touching upon that in the later slides. When you can assess by means of the PMCT changes, postmortem computer tomographic changes. A beautiful set of pictures thanks to ResearchGate. A lot of pictures I had taken from ResearchGate and with due recognition to them. And I always used to say, none of the work is my own. It is a compilation. I have begged, borrowed, written down, and downloaded knowledge of others so that it will be compiled and conveyed to the students. Look at this case. You find that this is a hand as such, and it is difficult to get the hand or the fingers straight. Probably a little bit of rigor mortis has been setting in, after which you cannot straighten it. But then, when there is a virtual representation or an imaging, you find that the digits can be presented as straight. And you can identify any of the abnormalities or sometimes a small tumor or a crack fracture, etc. And there can be a 3D reconstruction of the entire hand that is possible. Livor mortis. Livor mortis is in the sense there is a settling of the material based on the density. So this was the person, Shioteni et al., 2002, who mentioned the importance of hypostasis in livor mortis by postmortem computed tomography. Otherwise, everybody knows the importance of it. But then, by computer tomography, it can be done up to a period of 2 hours. Cardiovascular system, wherein high density fluid such as the RBCs, etc., can settle down, and then there is always a fluid level that is possible within a vessel, within an aneurysm, or within the ventricular chamber. Gravitational sedimentation can be made out. And in some areas like the cranial sagittal sinus, etc., you find sometimes the settling can be mistaken for a thrombus. And always a question we used to be asked is, what is the difference between an antemortem clot and a postmortem clot? Please go back to your class on thrombus. Lungs, what are the dependent areas? This is being called as hypostatic pneumonia. We shall see a picture of it. Similarly, there can be other regions such as the skin and the subcutaneous fat. Now, what are the vascular changes? And the collapse of the great vessels, etc., can be identified by computed tomography. Otherwise, it is difficult to retrieve. See what has happened over here. Again, thanks to ResearchGate. This has been a case of a hypostatic pneumonia in COVID-19. So, generally, this is a picture of a cadaver and there is a settling down. Normally, we call it a congestion, etc. But the forensic experts can be using it to their advantage. What are the exact position of the body, etc.? They can identify by means of this dependent livor mortis. And this is what we people are able to see. And this is from Forensic Medicine for medical students. And if you go to this code, you will be able to see it. And coming back to the CT, that is our main one. These are a pair of lungs, and I find that there is a settling of the fluid that is found in this case. So I had been mentioning it is not only the CT, it is not only the MRI, there is also a 3D MRI and also a combination of these. Along with it, there can be invasive techniques or minimally invasive techniques such as angiography. Look at this one. So earlier I had shown you a chronological age of a skull and dentition. But in this picture, we are able to reconstruct and then find out exactly what is wrong with the skull and also the age of the dead tissue. The age of the tooth, etc., is supposed to be very important in forensic medicine. Sometimes a biting habit of the individual, you find that there will be pressure onto particular tooth. All these could be made out with great difficulty in forensic pathology. But then, in this case, what happens is there are only images. You need not concentrate and pour all your attention. But later on, you find that these can be repeatedly studied. And if I'm still doubtful, I can get an opinion of a teleradiologist. Not only is it for the entire skull, but also the individual tooth that could be studied in a 3D form. So this again is ResearchGate. As I told you, it has got immense contribution to us in any of the subjects. So I would like you people to kindly make use of it. There are a series of pictures over here. These two are from the survivors. That is, the patient has been alive then. And these two are from post-mortem imaging. In this case, there has been intracerebral bleeding. And in this case, there has been an epidural hemorrhage. So these are made out when the patient is alive, and probably they can go in for treatment. There can be a decompression surgery and so on. In this case again, not only has there been a hemorrhage, but also a fracture of the skull could be made out. And also there is intraventricular hemorrhage over here. Normally you find if it is an empty space, it will be black in color. This is a very beautiful picture wherein there is a subdural hemorrhage pushing the brain parenchyma to one side and also causing the collapse of the ventricles. The background and purpose. Postmortem imaging along with CT and MR is emerging as an effective supplement, though not an alternative, for forensic pathology, postmortem. So what happens over here is a case of an injury, a skull injury, it can be either traumatic or a bullet or whatsoever. You find that the imaging helps. And at the same time, we should be careful. Here also, I am finding that there is some kind of compression of the ventricles, but then these can be mimics and should not be misread in autopsy. Postmortem gas formation. This is one. Probably the text of it is a history. It is about a girl having a oculocerebrocutaneous syndrome. So wherein there has been some amount of a rupture or whatsoever, and there is a gas that is forming a line. And in this one, they have found the autopsy and the postmortem CT 28 hours after death. So we should be careful. The gas can be because of putrefied gas in the intestine. It can be because of the portovenous system. Sometimes the gas may be formed because of cardiopulmonary resuscitation. And sometimes you find that organs like the thyroid may be inconclusive, so these need not be given much importance to. See what I'm trying to say. So here what the person says is there is an amount of gas that is being collected over here. As I told you, you find that air is black. And so also in this picture, there is a collection of air under the diaphragm or whatsoever. This picture is even more useful. So in this case, what I am seeing is a beautiful picture. So look at the advantage of my classes. This is the spine over here, and under the spine there is a gas that has been pointed out by means of this arrow. And also you find that along this vertebrae there is the gas. So this is the sagittal section that is displaying the air shadows. All this can be made out by means of using this CT. So postmortem gas formation. The cause of it can be studied, and one such cause is supposed to be cardiopulmonary resuscitation. Possibly when they are compressing the lungs too much, there is a probability of the gas leakage, rupture, etc., and getting collected elsewhere. Attenuation means there is a decrease or a disappearance. So normally you find that there is a gray matter and a white matter. You find that there is a compression that is over here. Normally it is not well made out. So there is a blurring and the loss of the gray matter. And the sulci are narrowed within a period of 2 to 3 days. And the CT density in the case of the white matter over here. This is a white matter and the CT is able to pick out fine details, just as you find that the MRI and the CT will be picking up details better than the ordinary X-ray. And what to screen for? There are a series of things that could be screened for. Infections, for example, foreign bodies. It can be suture material, it can be any traumatic splint over there, or it could be a bullet. And examining areas which are not usually examined. Normally, we talk about the different incisions, symphysis mente to symphysis pubis, opening of the thorax and then the abdomen, the different methods, en bloc dissection and all. But are we opening the skull? No. Are we opening up the arms? No. So these also can be picked up by means of the CT or the MRI. Any of the skeletal trauma that can be missed. Air embolism. I had given you some examples. Also, air collection elsewhere within the vessel can be made out. And all these videos can be presented in the court of law. And look at this cadaver. It is being treated almost like a human being or a patient. And all the data are being recorded. And what is the use of it? So the organs can be retrieved for transplantation. So this has to be done rather repeatedly or immediately. So immediately after death, there has to be, definitely you find that the retrieval of the organs cannot be done without the CT or the MRI. This is an important point which I had not thought of. So you find that it has to be done within 5 minutes. If you go to the first chapter in Province, you would have mentioned hypoxia sets in, rather anoxia sets in within 5 minutes, after which there will be changes. And there are certain organs which will not come back to normal. So they go in for the so-called irreversible injury. The cadaver transplant is one. And these are the various things. Skin and bone is less of a problem, and contrast medium can be usually avoided in such cases. The skull fracture. This is too obvious. It is a comminuted fracture on the skull, and once I open up by putting an incision, I will not be missing it. But when you do take a picture of it, even the smallest of the fractured bone can be made out. In fact, you can leisurely sit and count the number of bony fragments that are over there. Or even a subtle fracture like this can be made out, which are usually difficult during the routine conventional autopsies. And what are the difficulties? So for the new legal procedures, there is no standardization. We would have done something very sincerely, but then when we are countered by the opposite lawyer in the court of law, we will not be able to defend it. And the professional bodies support is needed for all this. As I had mentioned earlier, the Royal College of Radiologists in Australia as well as UK, they have tried to make this standard. And the CT scan, whatever said and done, cannot replace the conventional autopsy, particularly in cases like sudden cardiac death. So, in which I don't think the CT will be able to make out much of a change. And as I mentioned earlier, the circumstances can be fabricated. There can be false things that can be introduced in it. And also you find the CT can enhance the subarachnoid hemorrhage, hemopericardium, hemoperitoneum, etc. Look for and ask for. So look at this one. There is a skull over here, and in this, after the 3D reconstruction, MRI, there are multiple bullets that could be made out, the foreign bodies, air level, etc. What are the key points for the clinical practice? The cross-sectional imaging can be an adjunct to invasive autopsy. So, the computed tomography as well as magnetic resonance can be permitted. Single or multiple fatalities can be studied. So, as I told you, in a case of mass casualty, study also can be done in infancy. The infant autopsy is now important, but we do get very little material in it. And angiography for coronary arteries. The ventilated PMCT for the lung. In my earlier class, I had showed you how the lung is being inflated and how you get the image out of it. Additional laboratory tests such as the culture, etc., biochemical studies can all be done by means of guided retrieval of the material. Look at this quote. By concentrating on precision, one arrives at technique. But by concentrating on technique alone, one does not arrive at precision. Today, you find that these can be used as adjuncts or supplements, but they cannot be replacing a conventional autopsy. Just as a robotic surgery cannot be replacement for a conventional surgery. Otherwise, you find that one day engineering will be replacing medicine. Thank you.